Hello, another episode of the Living Room Podcast. I have a very special guest here with me. He goes by the name of Dr. Katsnelson. Thank you. It's a pleasure having you here with me.
Thank you for inviting.
No problem, no problem. We have a lot to talk about. And, I call you Dr. Katsnelson. That's what you go by, of course. That's your name, of course. But you wear a lot of hats. Can you give me just a brief description of everything that title-wise that comes with your name?
Sure. My name is Dr. Jan Katsnelson. I was a cardiovascular surgeon for 20 plus years, and I'm right now a CEO, founder and CEO, co-founder and CEO of USA Clinics Group, which includes USA Vein Clinics, USA Vascular Centers, USA Fibroid Centers, and USA Interventional Oncology Centers. And also a co-founder of Fibroids Fighters, non-for-profit organization promoting education and research of fibroid disease.
Great. And you got a lot of great things going, and one thing I really want to touch down on and speak with you about was in regards to the Fibroids Fighters Foundation that you have going. Can you tell me a little bit about how that got started, what motivated you to start that, and how it's currently going?
Great question. So a few years ago, we started, about 5-6 years ago, we started focusing on fibroid disease. Fibroid disease is a very, very common disease. Up to 80% of women get fibroid disease by age of 50. And even it starts earlier, between ages of 18 to 30, 26% Black women have this disease. By age of 35, 40, 60% of women and Black women, and by age of 50, 80%. And with white women, it's 13, 70%, also very, very common. So we start treating this disease with the innovative method called treatment, office-based, called uterine fibroid embolization. And we were shocked to find out that nobody knows about this. Women suffer. Tens of millions of women, about 40 million women suffer, and 20-30 million very symptomatic, and they just suffer or undergo hysterectomy. And we were thinking, what can we do to promote awareness, educate, and make sure people don't suffer in silence by themselves? And that's why we thought we can't do it alone. We need to bring this knowledge and share and use everyone together to do that. And that's why we created Fibroid Fighters. We have ambassadors. We have many great people that women and men that help us spread awareness of fibroid disease, and not necessarily how to live with this, but how it's definitely possible to stop suffering and cure this.
Got it. This is something that is now conversations are garnered towards it. There's more women that are actively speaking about it and raising awareness due to them experiencing fibroid disease or knowing somebody who has. I have a question. Why is it more prevalent and common within Black women?
It's a good question. We don't know exact answer, but we think it's something related to genetics and hormonal status. It's unfortunate. This is a common, like all women have a risk, but in the Black women, unfortunately, it starts earlier. They grow faster, seems to be more symptomatic, or maybe because they're bigger, but it's symptomatic. And it just affects life more. When you have 26% of young women affected life with a painful, prolonged menstrual period, a lot of bleeding, weakness, maybe even anemia. Many women take iron pills and they think it's a supplement, it's like a vitamin. No, it's not. It's a disease called anemia. Some even get blood transfusion. And some women even get hysterectomy, basically castrated in the age of 20s. Absolutely horrible. And also what's said that Black community, but I think everywhere, women not kind of used to talk about this. So when you think it's something unusual, you think about that maybe it's a disease, abnormal. right? But if everyone around you suffer from this, your mom, your grandma, your sister, your aunt, everyone has, like in Black community, very, very common, then you think it's normal. So there's a tendency to normalize abnormal, not call it disease, not understand, think it's a natural condition and it is what it is, and women meant to suffer. It's not. And that's why it's critically important to understand and differentiate what's normal menstrual period, what's normal inconvenience, and what's abnormal. And the reality is really simple. If it affects your life, stop you from doing regular things, stop your normal function, trust me, it's abnormal.
Got it. And what advice do you have for individuals dealing with this disease and the early stages? What may they do to get on top of things and making sure that they're being seen about this type of disease that's occurring within them?
So what really moved me to focus on this is the realizing that I know the secret. I know the special thing that will miraculously, like almost snap of the fingers, will make everyone feel better. So there was a treatment called uterine fibroid embolization that was known since 90s, a previous century. Some women were not even born at that time. And that's how long it's known, but it's very underutilized. So basically, what it is, imagine the fibroid disease like a tumors, benign tumors are growing inside the uterus. And the more you feed them, the more they grow, like a weed, right, on the field. So the treatment is very cool. It's bringing the catheter through the wrist, and through the long catheter towards the origin of the artery, blood vessel that feeds this tumors, and stop clogging. So like if you don't water the plant, it dies and shrinks. Exactly the same thing happens with the fibroids. When we clog this artery, called embolization, closing the artery, through the 1 millimeter in diameter catheter, they just shrink and get absorbed by the body. That's the treatment is done in the office under either light sedation, even local anesthesia. Takes 30 minutes. An hour, 2 hours later, patient goes home. No more suffering. No more 1 or 2 or 3 weeks, menstrual period, anemia, weakness, inability to function. And I knew that I saw in front of my eyes how those women get better. And nobody seemed to know and care. And that's what moved me and our teams, like, wow, we know something everyone should know, and we start working on this, with our doctors and with the fibroid fighters and ambassadors to spread the word. And it's covered by insurance, well-proved, amazing, covered by insurance, just one phone call away.
Got it. And so I have a question. Since this treatment is something that's available, approved, and something that seems to be a speedy procedure as such, why isn't it really spoken of commonly, as opposed to women that go to the extremes of getting hysterectomies in their 20s, or other things that may cause traumatic experiences for them later on? Why isn't this spoken about more?
That's the heart of the matter. Like, why people don't know, and I think it's probably many reasons. One reason is that it's not the most exciting topic to discuss, and people don't feel comfortable sometimes to talk in the family. And there's many women normalize, as I said, abnormal, because they don't realize that many doctors don't ask those questions. How was your period? How much? Some doctors think that period can be heavy and women can have anemia. Don't think about, also have a kind of guilty of normalizing. Also, there's definitely a role of, there was study the outcome and treatment recommendation depends where you're going. If you go to gynecologist, you'll get treatments that gynecologists do, which is either hysterectomy or myomectomy or mild, modification of those, because they do surgeries. If you'll go to interventional radiologist, then you'll have a most probably uterine fibroid embolization. The problem is, how will you go to interventional radiologist? Nobody almost ever heard of this specialty, and that's one of the things that you just need to ask, but people don't ask. I mean, that's ridiculous thing. Technology exists, covered by insurance, well-defined. There's a bunch of societies that talk about this, they think it's a standard of care. But it's like speaking different language in different country. This society is Society of Interventional Radiologists. They disconnected from patients. They don't see patients. They're behind the scenes subspecialty in the hospital. So that's a disconnect. You have people that do this, use this technology to do treatment, but they're disconnected from patients. And patients go to other doctors that by specialty, they just don't use this technology. And all other doctors probably, most of the cases don't ask enough those questions because women don't complain. So I hope it's not too confusing, but it's definitely something can be done about this. Awareness. And then doctors will be asking, women will be complaining, doctors will be asking right questions, and gynecologists and everyone will recommend the right things.
And just one more question I have on this topic. What is currently being done by this movement that you started to further on bring out the awareness of this fibroid disease? What is anything that we could be looking forward to down the pipeline as far as awareness or things that you have going with this?
So we work on different level. We work one-on-one with the patients and engaging them and asking them to share their knowledge with everyone they know. And also patients that had like fibroid survivals, kind of we call them, the one that had fibroid disease, suffered, that got the treatment, spread the word that how well they do. Other thing is we support and work towards bringing more information, support the bill that was introduced by Yvette Clarke, after Representative Johnson many years ago, and also introduced to Congress by Yvette Clarke and to Senate, but Kamala Harris last year, and it was reintroduced again this year. And it's a fibroid bill that called for support in the research and education of fibroid disease. It's shocking that most common disease that women suffer, by far most common, with the damages, at least, counted damages in the range of 20-25% of diabetes, has an NIH grant in the 17 million a year, 1.7, sorry, 1.7. It's like a drop in the bucket. Seems like nobody cares. So we do studies that we self-fund. We do studies to bring the knowledge, and we'll be publishing the data that we gathered after many thousands of patients we've seen and treated that have maybe 10 to 15 times better results than anything ever published in the literature. So from patient by patient education, treatment, and asking to working, supporting the bill in Congress and Senate, and talking to leaders in the community, engaging ambassadors, TV personalities, actresses, and many others to spread talk, and not being afraid to speak about the subject and bring awareness.
Got it. That's great, because this is, like I said, this is a topic that has now became something that women are slowly or gradually becoming more comfortable speaking about, sharing their experiences and awareness about fibroid disease. For a long time, women I knew may have developed it and didn't even know much about it. And it scared them because some of them were thinking, hey, what if I can never have kids? How does this affect me long term? These are thoughts and ideas that women that I know personally, um,
And by the way, the worst complication of this disease is not just the habit, prolonged menstrual period, anemia, and other. It's infertility. The fibroid disease is a #1 reason for miscarriages, spontaneous abortion. Why? You can imagine if you have a tumor, a bulge, something inside that can be the size of a grape in the uterus. Do you think there's a space for baby? There's not. They're competing for space, for blood, for other things, and that leads to spontaneous abortion. So it's a #1 reason for losing babies. And after treatment, after hysterectomy, you can have a babies, right? Normal uterus.
Right.
But after uterine fibroid embolization, you can have a baby. It even improves fertility. So and women don't know. So much we can help.
Yes, and there has been even an alarming rate of women that are now coming about and speaking about their issues with infertility, and movements and organizations are set up to bring awareness about women with infertility issues. And this was one of the things that were brought about was, this fibroid disease. And like I said, more women are now starting to gradually become more openly with speaking about it. And I just think that, the awareness and the information is very important to put out there in the community, especially amongst the Black community of women, because they're the ones that are mostly, affected by this disease. So what you're doing is very great, and the information that you're sharing is great as well. Dr. Katsnelson, you came from you were very, very successful in what you do. Can you give me your start of how you ended up coming this far within your practice?
So I started as a heart surgeon. It was ultimate miracle of kind of making a difference by stopping the heart, a sick heart, and then fixing it, and then restarting again, and it works better than before. That was amazing. The blood vessels, coronary arteries, valves, it was absolutely amazing. And I was always fascinated, how can we help someone with a less surgery? So I did a minimal invasive valve surgery. It's like heart surgery through 3-inch tiny incision. And then there were treatment percutaneous. And I started Friday afternoon when my wife opened her office. We together kind of added my practice in the office. We start treating varicose veins, venous insufficiency, congestion in the legs that before was treated with the stripping. It's a barbaric treatment that was done for 100 years. And minimal invasive, instead of treatment in the hospital with a 3-month recovery in pain, was turned into a few-minute treatment in the office, and like almost lunch or almost drive by. They come, get the treatment, go home, or go back to work. So it was firsthand experience that there's definitely a huge difference between what was gold standard, what people did before, and what technology can bring. It's like a driving carriage or self-driving car, something like this, a wireless phone. And so there's a lot of it in the medicine that we start to look at what can we bring to patients that need it. So let's start in Chicago, half a day a week, then we more, and then we added office in New York and Brooklyn, and then more in Boston and LA. And we have almost 100, I think 98 locations in 18 states, and almost 40 in New York metropolitan area, mostly in underserved communities. Bronx, Queens, Brooklyn, Washington Heights, Manhattan. So why is that? Most of our doctors are cardiac surgeons, vascular surgeons, interventional radiologists, interventional cardiologists, doctors that enjoy and dedicate their life to make the most difference. Where do you make the most difference in medicine? When someone's sicker than average, when you have a more sick and undertreated patients, and then kind of we gravitated towards areas that needed the most help. And that's what really brings joy, to see how we can transform and help one patient at a time, one family at a time, one community at a time. And we say that it's just very beginning. So much can be done to bring health and improve health equity in the communities.
Yes, yes, indeed. And the Chicago Heart Institute that you founded, can you tell me anything about how that's currently going and how has that bloomed from when you first started that to where it's at now?
Okay, so, I was a heart surgeon for 21 years, and that was a part of our, that was a Chicago Heart Institute. And then we started vein clinics, Chicago Vein Clinic and USA Vein Clinics. But, interesting timing of your question. We're going to restart working more on the heart as well. Think about our organization as bringing top-notch health care into the communities. And I think we'll be starting very soon with a screening, early detection of heart disease and cancer in the community. It's something that will be going this year, and I think it will be a nice kind of circle where I started, what we've done, and now we're coming back to those heart conditions.
Right. We've experienced COVID. We're still going through the COVID era right now, and there are a lot of people that have developed, heart issues or had pre-existing health conditions that have worsened those issues with COVID. How have you seen the effects of that throughout this time?
Great question. COVID definitely it made things that were not as clear very clear. The underserved community, people that suffered the most. The way we behave, the way we eat. For example, in the beginning of COVID, there were so many blood clots that people experienced. Part was the COVID and probably the virus. Part was inactivity and eating a food, stored food that that is very salty, because people were at home. They just bought tons of food and there was all salty food. And in our veins, when we have congestion and blood flow a little slower, there's a tendency to form clot. So sitting, not walking, misbehaving, eating salty food, drinking a lot of that gets those clots. So it just reminds. So in the first few weeks, we remind everyone, please eat well, walk, move, even at home, even around kitchen. Just be very, very, very active. Also, it definitely was terrible for women that with a fibroid disease, because even in the regular life, it's difficult. They suffer pain, going to the doctors, sometimes going to urgent care, scared, get reassured, get some help. When you're afraid to go to the doctor, afraid to go to the hospital, because it's simply dangerous. Simply meeting other people at that point was dangerous. It's so much to stress and limitation of life. So there were good things that will learn and influence us moving forward. Bringing telemedicine, ability to communicate with patients remotely, ability for people to understand the value of health and how they need to be proactive and be vested in the health. So, that's life. There's a good, bad and good. And I think we'll be drawing many lessons from this terrible and stressful period of everyone's lives. But, I think as a healthcare organization, we should come out with the lessons, how better we can serve our patients and communities.
Right. And so this COVID disease, there's a lot of, new research that's being found and, tests and everything that's still being done. Why is it, if you could answer, that this COVID disease affects some, the heart of some individuals that probably didn't have pre-existing health conditions. How is it that it could take effect of that so commonly from what we're starting to see now?
So most common organ that suffer is the lungs. Okay, it's not heart, but for some patients there's inflammation in the heart as well, and that makes heart a little swollen and thicker and less functional. And I think fortunately we know better how to treat it. Many times heart condition was secondary to lung failure. So mechanically, think about this way. Lungs is the organ that oxygenate the blood. So it's basically a pump. The blood is pumped through the lungs and it's aerated so in order for blood to go through the lungs, blood vessels in the lungs need to be quite open. If there's any problems with the lung, inflammation or anything, the blood vessels can be more constricted, closed, and that creates tremendous pressure. Like when you pump into something and blood doesn't go through, and that's what happens with the heart. And it used to pump well, and it cannot because too much pressure. Also, the heart by itself was affected by the virus and inflammation, and it was very, very, very confusing and new for everyone to understand what's going on, what's first, what's second, what leads to that. That was, I think, terrible. And suddenly the healthcare system was overwhelmed by this new disease, lack of history and best practices, and that was heroic from medical workers to go through this and get better and help so many patients, especially in New York and places that had a very difficult time, but I'm glad it's much better. I mean, there obviously, even people when they get sick, they get much, because we know more. We get much better treatments, much better results, and for sure, this vaccination and everything is what's done by the government and all the community and systems makes a huge difference. I hope we'll see with the tail end of it, and I hope we'll see the light very, very soon. We have at least some of the summer as normal as possible.
Most definitely, most definitely. I have a quick question for you, Dr. Katsnelson. How long have you been practicing?
I graduated medical school in 1990, so it makes.
Born.
You see, it's okay. But I feel like I'm a constantly student. I'm learning and teaching, and when I know something, I want to make sure everyone around me knows. And quite often we learn and we invent, and that's why I feel like my life has the stages, and the medical career has a stages, and we have a luxury. We have a great organization. We have more than 500 people in our team. Amazing, super strong doctors, amazing staff, and everyone from call center representative to the back office people that get approvals from insurances, and our marketing department that does awareness campaigns. Everyone, people, medical assistants, nurses, everyone. And what's amazing is that there's an opportunity to focus what matters the most and where can we focus to make the most difference. And that's why we, in our organization, we're focused on the most common curable diseases. Something that's very, very common, people suffer, sometimes don't even realize that they can stop suffering, and we can cure, heal, get it done, basta, no more. So that's what we found, the miracle of vein treatments. It's ultrasound guided, that was very, very good, and basically we can fix it. That's the miracle of fibroid treatments. Uterine fibroid embolization in our hands has less than 1.2% of need for recurrent procedure. It's nothing. After myomectomy, a minimal invasive surgery, it's 30, 40, 50% chances that in 2, 3, 4 years it will come back. So we took condition that people think that they have no choice, suffer, and we cure. And we're looking for more and more conditions like this. Hopefully we'll be able to, we started even treating cancer in earlier conditions and helping the people, and hopefully we'll keep going and make a more and more difference.
Yes. I'm looking at the awards that you have won, Dr. Katsnelson. I see in 1990, you won the Euro Medical Academy Award in Russia. In 2002, the American Heart Saver American Heart Association Award. 2005, the nation's double implant of new tissue heart valve award. Tell me, if there's anything else that you take from doing what you do, what is the biggest thing that just keeps you going and fuels you in your field, in your practice?
Listen, sometimes I just need to be in the right place in the right time. I mean, the American Heart Saver, I was in the lecture, then there were many interesting people, and one guy just didn't feel good, and then basically had a heart attack. So a neurologist said that he has a stroke. Professor of pulmonary care said, critical care, he stopped breathing. I was a cardiac surgeon, so I just put my hand on the pulse. I said, guys, he's dead. No heart. So we start doing the CPR, and that was on the campus of University of Chicago. So ambulance came, and hour and a half later, so we did like shock, and we revived him. Hour and a half later, I did the heart surgery on this guy, and he was famous physicist. I was trained in space, astronaut. So that was, and he's still alive. That was many years ago. But what really motivates is, I feel that we have ability and obligation to make a difference. And it's really a free will opportunity. If you put your mind to make a difference, and it's real, and you have a good people around you, family to support you, and teammates to support you, just need to work towards the goal and get it done. And we have the best goal: improve lives, extend lives, make sure that people are happy in their lives, and that's a blessing to be a doctor. We have a license and an obligation and privilege to be able to help people, and I don't even think it's a job. It's a great thing. Enjoy every minute, and I think everyone who around me that they're very much involved in the care, they take it as a passion.
Yes, because you're doing great things. Also see you're actively involved in the Save a Child's Heart to you're extending to children. You're making sure that they're fine and that they're getting the best health opportunities as well. Can you tell me a little bit about that as well?
So again, I was lucky when I was a resident in a heart surgery. It was in Israel. There was a young American doctor, came from Washington, D.C. After Walter Reed and a fellowship in Toronto Children. He was a pediatric cardiac surgeon. And in our department of cardiac surgery in Walson, Holon, a suburb of Tel Aviv, there was no pediatric heart surgery. There were just adults. And his family got a call from friends from Ethiopia that heard that their son, this Ami Cohen, was a pediatric heart surgeon, and they asked maybe that he can help. Tel Aviv is closer to Ethiopia, Addis Ababa, than America. And seems impossible. How would you do that? He found a way. One girl, another girl, the patient, the family live in his house, and then step by step, it happened. 2 years ago, this organization, Save a Child's Heart, received United Nations Population Award for treating more than 5,000 free, no-cost heart surgery for young folk, for children from more than 50 countries. Plus, they created a pediatric heart surgery system in a few countries like Tanzania that many times, bigger than Israel or Ethiopia and other countries. And when you have examples like this in front of us, in front of me, you start believing that everything is possible, because they were able to create this program at just goodwill and helping of many volunteers and people that donated time and effort and money to help this endeavor. So it's been more than 25 years, and it goes very strong. And now they even built a hospital, a 7-story huge hospital, the best pediatric cardiac care hospital in the whole part of the world, in the Middle East and all this part of the world. And that was absolutely amazing. So it's just example that showed me that everything is possible. And I hope our example of fibroid fighters and what we do will inspire many more people, not just take care of their own health, but do something to make a difference for others.
Most definitely. I appreciate speaking with you, Dr. Katsnelson. I actually want to speak to you again in the future when there's more information and things that we can speak about with your organization and things that you have coming in the future. It's been a real pleasure to have a conversation with you.
We'll be delighted. Thank you so much, and thank you for the opportunity and bring awareness and knowledge about fibroid fighters and opportunity to treat fibroid disease.
No problem. Is there a website or anything where people can connect and find this information from you that you would like to share?
Absolutely. It's www.usafibroidcenters.com and www.fibroidfighters.org. usafibroidcenters.com and fibroidfighters.org. And don't suffer in silence, and the help is one click or phone call away. We'll be happy, delighted to help.
Great. I thank you greatly. Is there anything else you want to tell the people while I have you on here?
Yes, most important thing. What you heard today, that the fibroid disease, a painful, prolonged menstrual period suffering is not normal. Please share with everyone you know and ask them to share with everyone you know. And the second thing, please know that there's a cure, and it's called uterine fibroid embolization. Should be number one a treatment before deciding about anything else. And it's minimally invasive. Just Google, you'll get so much information, and that would be fantastic. Just spread the word. Thank you.
Thank you. It's been a pleasure.
Thank you very much.
All right. Bye now.
Thank you.